guys, happy Friday. For today's Q&A, I'm going to answer your questions about a popular beauty treatment, facial massage. This is sort of in the same vein of some of the more recent Q&As I have been doing about popular beauty treatments like jade rolling, sauna, steam bath, and dry brushing. But you guys asked me a fair amount about massage, facial massage. Is it good for wrinkles? Does it help your products absorb better? So today I'm going to touch on those things, what the evidence to support facial massage is. It is performed with the goal of relaxing the tissues, with relaxing the nerves, improving lymphatic drainage, reducing swelling. It's promoted as improving skin radiance, luminosity. It's also promoted as enhancing the skin's ability to absorb topically applied products, skincare products, active ingredients. And proponents of facial massage also claim that it can be helpful for wrinkles, for renewing the skin, and for boosting collagen. By and large, regardless of the type of massage, whether it be facial massage, as I'm speaking about here for a beauty intervention, or total body massage, like a deep tissue massage for muscle relaxation, I think people who pursue these and find benefit, myself included, agree that they are relaxing. They help reduce stress, they help improve soreness, tension. They're very, very relaxing. They help you to sleep a little bit better. I know I always sleep like a rock after I get a massage. And so, yes, facial massage is definitely going to be a relaxing experience for most people pursuing it. And so it can help to reduce muscle tension. If you are someone like me who clenches their jaw a lot without even realizing it, gentle facial massage of the jawbone, the mandible, can definitely help to relax that muscle, that masseter muscle, and kind of put you back in check or put you back in balance and help to reduce some of that clenching and grinding. Grinding, clenching, it can occur outside of sleep. It can occur throughout the day. I grind my teeth, for example, during the day without even realizing it. Just chronic jaw clenching can really put a lot of wear and tear on your teeth, and with time the muscle in your jaw can get kind of a workout and hypertrophy slightly, and subsequently alter the shape of your face a little bit. Your face can appear slightly more swollen perhaps. Another benefit from the relaxing effects of facial massage is its impact on sleep quality. When we relax, we sleep better, we have an easier time falling asleep, and I cannot overemphasize enough the profound impact of restorative sleep, not only on skin, the skin barrier, the ability of the skin to repair some of the damage that it encounters throughout the day, recover, restore, all of those buzzwords, they actually do happen, and they happen much better if you get restorative sleep. You know, if you are awake at night, that chronic stimulation, it impacts your immune function in your skin. So restorative sleep can really, really, really heal your skin. And the assistance of relaxing facial massage to aid in getting you to sleep, it can be paramount. It's much better than having to rely on a medication, an over-the-counter sleep aid. Those can really kind of gork you out and make it difficult for you to get true restorative sleep. But the simple relaxing effects of a massage and reducing tension can make that a lot easier for you. And that effect goes without saying. You're going to see benefit in your skin from a relaxing facial massage when you get it, when it helps your sleep cycle. No doubt whatsoever. I think we have the most evidence that massage is helpful for muscle tension, relaxation, and aiding in things like chronic pain. It can be very helpful in a condition known as fibromyalgia. We don't have as many studies. We have actually very, very few studies on the outcomes of facial massage in skin health, skin biology. We do have a few very, very small studies, some of them laboratory-based, some of them actually in people. Some look promising, others conflicting, some kind of in the middle. There was a study in India, in New Delhi, of 142 women who sought facial massage in various spas in New Delhi, reputable spas. In this study, they observed the women for 12 weeks, and they showed a few actual adverse effects from pursuing facial massage. About 36% of the women had redness and puffiness that manifest about 15 minutes to upwards of 2 hours after the facial massage. About 5% of people that they followed had a mild dermatitis afterwards. They didn't really define what they meant by a mild dermatitis. Dermatitis is kind of an umbrella term in dermatology to mean inflammation in the skin or an inflammatory skin rash. It's an umbrella term. There are many different types of quote dermatitis, so it's hard to know exactly what they meant by that. And also 33%, this was the most kind of shocking, 33% of the women in the study showed an acne-like rash that was actually quite profound, anywhere from 3 to 10 weeks after getting the facial massage. And this acne-like rash had a very characteristic manifestation of deep-seated painful nodules on the cheeks, specifically in the areas that were massaged on the upper cheeks. Those painful nodules then went on to heal with what's called post-inflammatory hyperpigmentation, or dark marks. However, I think it's important to note that in the study, not only were the women getting facial massage, but they were also getting some ancillary things in the spas. They were having things performed like comedo extraction or extractions. They were having various oils and cosmetic creams applied to the skin. So it's hard to know if it was specifically the massage or something else that they were doing, that they were having done on those days that they were getting massage, whether it be a particular oil that was acne inducing. This study didn't look into that, so it could have been a number of confounding factors. Another limitation of that study also is that just 3 beauty parlors in New Delhi. Beauty parlors, that's what the authors refer to them as. It's just 3 beauty parlors in New Delhi, so that's not really representative of everyone out there performing facial massage. By and large, it's not something that commonly walks into the office of, ooh, I got a bad rash after a facial massage. For the most part, people find them relaxing and enjoyable and report seeing benefit in their skin. There's a subjective improvement in the skin that people report when they pursue this. Proponents of facial massage claim that it increases the absorption or it enhances the penetration of active ingredients in skincare products. Is there any truth to that? There is one study that examined the role of skin massage in outcomes of moisturizer application. I will say that. What they did in this study, they looked at 13 women and they applied a moisturizer to both forearms, and one forearm they massaged and the other one they didn't massage. And then they subsequently measured things like transepidermal water loss, skin capacitance, which is basically how much water there is in the skin, so hydration, and skin elasticity. And they showed in that study that there was actually increased transepidermal water loss and no difference in elasticity between massaged skin and non-massaged skin in terms of these measures after applying moisturizer. However, you can see there are some limitations to the way that study was done in that they were massaging the skin after the moisturizer was applied, and they weren't actually measuring anything in terms of absorption of the moisturizer. They were measuring outcomes of transepidermal water loss. I think a better way perhaps to have done the study would be to do the massage and then apply the moisturizer and then subsequently make the measurements to see if the ability of the moisturizer to aid in skin barrier recovery was enhanced by pre-massage. But they didn't do it that way. It was a very small study, very few participants. So there are several studies that show, at least in skin models, that massage after the application of active ingredients that are in liposomes, which are just little fatty particles, that actually helps in increasing the depth of penetration into the follicle of those liposome ingredients, the active ingredients, increases the depth of penetration of those ingredients with a little bit of massage, just by kind of directing it down the pore, down the hair follicle, can increase that. And it's particularly profound in areas of the skin that have a high density of what's known as pilosebaceous units or follicles, like the face or the scalp. So going back to the other study, looking at the moisturizer, you might posit that another limitation is, well, maybe the density of hair follicles in the area that they're applying moisturizer to is not sufficiently dense to really see a profound impact either. That maybe if they had looked at the face, where there are more pilosebaceous units, maybe they would have seen a different outcome. But I really do think that it is very plausible that certain skincare ingredients, active ingredients, their penetration into the follicle is enhanced by a little light circular motion, a little light massage. Some people claim that tapping the skin is another way to do that. I haven't seen any studies to support that, but I have seen studies, namely in skin models, I'll list them down below, that show that there is increased penetration. In other words, I don't think we have sufficient evidence to refute the claim. We have a little bit of evidence that suggests that maybe there's some truth to increased absorption of active ingredients with a little bit of facial massage. The jury is still out. How about aging? We have even fewer studies that look at the outcome of facial massage on aging, skin aging. I think some of the claims and ideas are that, well, with a little bit of massage, you just kind of increase circulation in the skin, and by increasing circulation, you increase the circulation of growth factors and things that maybe are important for skin renewal. There's one small study that I came across that looked at facial massage in women in their 60s to 70s and showed actually a pretty marked improvement in fine wrinkles and fine lines. And they also took some skin samples after the massage and looked at them, and they actually showed right at the junction of the epidermis, the top layer of the skin, and the deeper layer where all the collagen and stuff is that gets damaged and leads to wrinkles. That junction was actually showed some increased expression of some of the proteins that are important there, like different types of collagen, different dermal matrix proteins. That was actually increased after the facial massage. So that preliminary study seems promising that perhaps a little bit of facial massage could, in fact, boost dermal matrix protein synthesis, resulting in increased suppleness of the skin and an improvement in the appearance of wrinkles and fine lines. Seems promising, but a very preliminary study at this point. A few points of caution to note when pursuing facial massage. The active massage does result, just physically that active rubbing, does result just a little bit in increased barrier dysfunction, transepidermal water loss. Definitely not to the degree that you see with dry brushing, but a little bit. And as some of the studies suggest, it can increase penetration of active ingredients potentially into the pore. So one note of caution with the facial massage is that sometimes they will apply different cosmetic creams, different cosmeceuticals. Sometimes they have fragrance and essential oils. So it's kind of a setting for you to potentially develop an irritant dermatitis, more so from those creams. And you've kind of primed the skin to be even more hyper irritable. So that's a potential adverse outcome that can occur, and I'm sure does occur. I haven't actually ever run into any cases of that to tell you for sure though, but just logically speaking, if you're somebody that has very sensitive skin, you definitely would want to be careful in that setting. And that's something that in, any aesthetic spa, they're probably going to ask you about that before. Yeah, I would assume, I've never had a facial massage myself, but I have had a body massage, and they generally do ask some, medical information, like, are you taking any medications that might increase bruising? So I imagine, they also ask you, if you have a history of sensitivity or allergy. So that would be something that, most reputable spas would probably ask you about before moving forward, but just something for you to think about. The other risk is for people with rosacea. I would say no. That's who worries me the most. The active massage of the skin does result in increased blood flow, vasodilation. For rosacea, that's the opposite of what you want to happen. That can lead to a flare and worsen your rosacea. So I would be really, really, really nervous if I had rosacea to go having a facial massage. Again, though, I think that is a condition that they likely ask you about before you get a facial massage. They're not, most estheticians aren't going to do a facial massage on somebody with super sensitive, hyper-irritable skin, such as in rosacea. I would hope. The other situation that you would definitely want to proceed cautiously, if hold back on, is if you are somebody with acne and you've got active acne. Big, inflammatory lesions, especially. You don't want people massaging on that area. It can lead to worsening of the acne just by the irritation of the increased blood flow and everything. It's not really going to be particularly helpful and can probably cause some problems for you. So I would say stay away from it in that setting. But by and large, facial massage is a pretty benign thing to pursue, and around the temple area, around the head, can be so relaxing, help you fall asleep at night. And boy, a good night's sleep, restorative sleep, relaxation, there's no doubt that your skin is going to see improvement. Facial massage can also be helpful if you are somebody who carries a lot of tension in your face and you're getting tension headaches as a result of that. It can really help to relax those muscles and subsequently improve headaches. I think it's not an uncommon scenario for people to not only have poor sleep because they're stressed out, anxious about all the stuff they have on their plate, but then they go throughout their day carrying all that stress with them, clenching in their face and holding a lot of tension in their face. And those two things together definitely take a toll on the appearance of your skin and your overall skin health, as well as your overall health and well-being. So taking some time for yourself, having a spa day, getting some light, gentle facial massage, I can definitely see how that would portend benefit to many people. Bearing in mind, some of the reservations I have in certain groups: rosacea, sensitive skin, bad acne. While the studies are limited at this point to support the use of facial massage for enhancing delivery of active ingredients, I think they're promising, and I'd say the adverse effects from facial massage are pretty limited, low likelihood, but not completely out of the water. Again, those conditions that I mentioned. But yeah, I definitely enjoy a good head rub, a good jaw massage. I find myself doing this when I've been reading for too long and I'm getting a headache. Very helpful, very helpful. So I hope today's Q&A answered your questions about facial massage, its benefit on the skin. And if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.